Multiple cut RK, over 20 cuts with the RK incisions, as you can see, are so broadly splayed that they've caused dense central scarring in this surgeon, and also have very, very difficult arcuate cuts in between to deal with. And I did a lamellar surgery here, and I had to buttress my anti-torque suture to go through the RK cuts and yet get everything and clear the center and build the cornea. So, Dr. Kevin, that was your eye before and after, and I'll describe here for the doctors who are watching what we did and the philosophy behind it. So Kevin, you know your case already, the extremely dense cornea scar, with your multiple cut RK with the open cuts, and how it was giving no other options besides full transplant, which we want to avoid. And again, you brought your friend here today who's also an oral surgeon, and I like the way you said it, you know, saving the tooth. So just doing a full transplant is the easiest thing to do. But we did the most difficult thing, is lamellar surgery on these cuts and get away with murder. So in his eye, basically, he has these multiple cuts that are very deep and open, unlike normal RK, and they led to very dense scarring in the center, thinning of the cornea, and irregularity with extremely high hyperopia, presbyopia, astigmatism, very high irregular astigmatism, over 21 diopter astigmatism, and unmeasurable, and thin cornea with central scarring. All these factors I like to look at, and the fact that in the future he will need cataract surgery. So we did a lamellar surgery where I went in and lamellar dissected in between this very fragile and unstable cornea with its cut, and managed to remove this top layer, which I then removed and used a donor cornea of just that same thickness and placed it on this. The difficulty I had here was of suturing that in between the cuts and his AK cuts, Kevin, in your case, and yet putting it back in place, and without entering the sanctity of his inner eyeball. That was the beauty here. And this way he's also prepared for his future cataract surgery. And now today, as you saw from the pre and post-op picture, you can see a tremendous difference. And your comfort level, Kevin?
Yeah, I'm great. Yep.
Perfect. Now, the other patient I did the same day was a different kind of problem. Many RK cuts, but they had an endothelial problem. The back layer of this cornea had a disease which causes the cornea to swell and accumulate water. It's called Fuchs dystrophy. In that patient also, relentlessly not wanting to do a full transplant, I left his RK cuts because we had done a very successful multifocal cataract surgery through the RK. He was seeing great 20/20. And we went and we again peeled off just this back layer called the decimus membrane. I threw it away and replaced it with a donor decimus membrane, and as you saw, with an air bubble. So no stitch, his RK cornea still there, multifocal lens in place, and we replaced the endothelium and gave him full clarity. So even on that single day when I did so many corneal techniques, you can see, I liked what you said, doctor, about how to save, in your case, because you're a dental surgeon, how to save the tooth, in this case the eye and the cornea, without doing the easy way out, which is full transplant.
You did a hard endo and tried to save the tooth early, just extract it, which everybody would have done.
That's the surgeon talking. But yes, so it's been a pleasure, Kevin, and that's the technique for you. And for the surgeons who are watching, please do fight for your patient's vision, and more importantly, please fight for their lifestyle, because it's easy to do a full transplant and walk away, but even these difficult cases, you must struggle to give them their integrity. Look at him standing today. I have no problem with him going and playing golf or going and doing his difficult surgeries, because there is no weakness in his eye. We have moved him, come Kevin, please take a seat. We have moved him from this situation to this situation and doing very well. Again, pleasure, Kevin, and I see you brought your friend here, another surgeon, and we'll review what his needs are, and be an absolute honor.
Thank you.
Anything you need to say, or?
Well, what they don't know is you've done the other eye already, and it's turned out awesome.
Yes.
And so just, was it 7 years ago maybe?
Yes.
We did the other eye, and it was really early in our relationship, and
yes,
I'm seeing great out of it, and it's healed and been wonderful. So I had no problem having Dr. Gulani do this one.
I'm sorry, I forgot that. That's a great point, that yes, his other eye also was equally bad, and we did a lamellar transplant in that eye too. And this eye was even more difficult because the cuts were even more deeply spread out, but nearly equal. And yes, that's a very important point. And consistency in the fight is again, everything I talk and teach about. So hope you guys get to learn from this, and more important, become tenacious in helping your patients. So
please help your patients.
Coming from 3 doctors here. All right, good.